Hi, this video is to explain how to do the doctor's data heavy metal urine testing. And so we do this test versus a blood test to look at heavy metals in the body because a blood test is only going to look at very recent exposure to heavy metals versus a provoked urine test is going to look at a longer term exposure and help to determine body burden of heavy metals. So you have already gotten this kit for heavy metals from Doctor's Data, the company that we do the test with, and I'm going to explain how to do this. You should have already gotten a prescription for DMSA. DMSA is the chelating agent that you are going to take prior to the 6-hour urine collection. Okay, you should have already picked that up from your compounding pharmacy. If you don't have that yet, I would not do the test because you'll just have to do it over again. And so DMSA is the chelating agent that pulls those heavy metals out of their hiding places, and that is why we collect our urine for 6 hours after taking the DMSA, okay? And so what we're gonna do is wake up after avoiding fish for a week. Remember, no fish for a week. You can take fish oil. Fish oil is okay, but no fish or, shellfish. Okay, so you're going to wake up. You're going to waste your first morning urine, flush it, be done with it, okay? Then you're going to take the DMSA capsules from that prescription, okay? Everybody's dose is going to be different based on their weight, and so make sure you take exactly what is labeled on the prescription bottle for you, okay? So after you take those DMSA capsules, any urine you make from the time that you take the DMSA capsules for the next 6 hours, you are then going to want to collect, okay? So if you wake up at 6 a.m., take the capsules at 6, then you're going to want to collect your urine all the way up until noon, okay? And so when you take the DMSA capsules, you can take all the liquids you want, but you do not want to eat physical food for 2 whole hours, okay? And the reason we do that is because we really want the DMSA to get in our system, so we only have to collect our urine for 6 hours. Otherwise, you would be collecting your urine for 24 hours, which is really no fun. And so that is why we don't eat for 2 hours after taking the DMSA, so we only have to do that 6-hour urine collection, okay? And so when you open your box, you're going to see your requisition. I'll explain more about that later, but you're going to want to collect your urine in here in this cup, and then you're going to pour it into this bag, all right? And so, like I said, any urine for the 6 hours you're going to collect and then pour in here. At the end of the 6 hours, this will be full. You are going to want to, make sure the top is on, obviously, mix it up, get it nice and homogeneous, and then you are only going to want to send to the lab a sample up to that black line. So you literally pour it from the bag up to the black line. All right, that's why you want to make sure it's really mixed up nice. Put the top on, and then it goes in this little biohazard bag, and then the biohazard bag goes back in the box, and then you can throw away your bag, dispose of the rest of the urine, and also the cup. You can get rid of that, okay? And then so all that's going to go in the bag is going to be your sample in the biohazard bag. You are going to want to enclose your requisition. Your requisition is your identifying information with your address and, the test and, my signature on it for the test. What you are going to want to make sure is filled out on here is the date of the sample collection, okay? So the lab will not run the test without a date of sample collection. And I don't know what day you're going to do it, so we can't fill it out for you. So make sure you fill that out as well. And if you are a Medicare patient, you are going to want to flip it over and fill out the back side. So if you're a Medicare patient, you're going to want to click option 1, check option 1 here, and then sign with the date. That just says, Medicare is not going to pay for the test and you want it anyway. If you are not a Medicare patient, then don't worry about it. Just make sure, the date of sample collection is filled out. Okay, so the requisition obviously is going to need to go in the box so the lab can identify the sample, and after that you're really all set. All you're going to do is close up the box, okay, and then inside the box you're going to have a FedEx label. It is prepaid and pre-labeled, so all you're going to want to do is, stick it on the bag, throw the box in the bag and you're all done. Congratulations for finishing the heavy metal urine test. If you have any questions after you watch this video, just call our office and we'd be happy to answer them for you. All right, bye.